I have a very strong passion for dentistry, and implants to me is a very important part of dentistry that is not only lively and exciting, but I feel that the whole community, the whole dental professional should be embracing it more and delivering much better dental implant care. When GDIA was formed, I was very happy to be invited to be a part of this team. We were able to bring in a lot of good people who are passionate like myself, love what we do, and also to share the information so that ultimately our patients will benefit. We strive to make this organization one of the strongest implant educations out there. We want to recruit more good individuals that will come and join our mission of teaching and trying to excel in the skills that we know in this very exciting field. I'm very happy to be part of this team.
My involvement with implants started when I started my prosthodontic residency at UCLA in 1986. This is when Bronimar 20 years study started, and we started using that system, and we were pioneering, as we say, the UCLA abutment and so on. One of the main goals of GDIA is mostly to promote a nice professional atmosphere for learning. And for us, learning is a serious matter. The reason why teaching for us is a serious matter because, as you know, it's a great art of all the arts that are available for us. And the reason why it's a great art because the medium is the mind and the spirit. Another goal of GDIA is mostly to create some kind of an atmosphere that we can share our dental experience, to expand our knowledge, and to expand also our inspiration. And it's a place for to incite, as we say, the love of learning. What's the bottom line of GDIA goals is the winners. Who's the winner? The winner is our patient.
We have a practice in Murrieta, California. We've been practicing about 10 years, and for about 8 of those years we've been placing dental implants. It's an exciting new area for most general dentists, and we feel like we're on the cutting edge of this new technology. I saw the need for it. Basically, we were sending a lot of our patients to the oral surgeon's office, a periodontist. They were coming back with the implants placed. I researched it, looked into it, took some courses with Noble Biocare, my first courses I took, and basically started placing them again about 8 year ago, and haven't looked back. It's been a great part of our practice, a great supplement to our practice. I feel that we're a high-tech practice. Recently we've acquired a CT scanner. We take CT scans on all of the implant patients. Also, we are into CAD/CAM technology. We design and fabricate our own surgical guides in our office, as well as design and fabricate the dental restorations, crowns and bridges and such. I feel I have a lot of experience and a lot of knowledge that I can share with my colleagues. We've made mistakes, and we can pass along the good and the bad to other doctors and colleagues. I feel it would be some valuable information, and we wish to share that. I think dental implants will become a standard component of the general dental practice of the future, just like a crown is, a bridge is, or a gum treatment. The procedure is not that difficult. Once you follow some fundamental concepts in treatment planning, I feel like any general dentist can accomplish a dental implant placement.
I have been involved in implant dentistry since 1980s. It has been a very fascinating field of dental care for me, and ever since then I have been learning and improving, participating in different programs. So implant dentistry is a very interesting part for my practice. Implants are very integral part of our modern dental services. In the past, we were using partial dentures or fixed bridge works, but they are a thing of the past. We try to preserve all the natural teeth as much as possible in healthy state. And if there is a missing teeth, instead of using other prosthetic devices, I recommend implants for those replacements, and that has been helping the lives of our patients significantly. So I'm very excited about implant dentistry. It has improved my dental practice greatly, and I think it's getting better all the time. I think GDIA is a great organization. It is a group of very committed dental professionals learning and helping each other and participating in different programs. And GDIA is providing many different levels of education. Particularly this personal coaching and training program is a very excellent idea, whereby a dentist who is interested in learning more intimately in providing directly patient care, they can have personal coaching and work with a mentor together. So this way they will have much more confidence in learning the placement of dental implants in the patient's mouth. And that's a great ways to learn and improve your practice.
Yes, I've been involving so many years in implant dentistry as a student and teacher. During these years, I always looking for quest for excellence in implant dentistry. Finally, last year I joined GDIA mentorship program under supervision of our two excellent directors. Since then I've been learning a quite large amount of the surgical skill and the knowledge, combined with my previous experience. While I'm doing the mentoring other doctors at live surgery in Mexico and in other the clinic, it really helped me to refine and redevelop my implant skill and knowledge, and then it also matching my goal to looking for the questing for excellence in implant dentistry. I recommend to anyone, to doctor who looking for the same goal as I have, GDIA is a solution for them. So good luck for everyone, and thank you very much.
I joined GDIA mainly because I was impressed by the way they targeted and recruited some of the best minds in our industry. And I'm honored to be working side by side with some of the best clinicians in the field of oral implantology today. I started restoring implants about 10 years ago. I got into surgery 7 years ago. Yes, I am particularly impressed with the GDIA program. I think they have definitely set a new bar in the field of implant education, both from a clinical point of view and also with the highest levels of ethics, especially with the Mexico program that we have. We wanted to make sure that all the patients are looked after properly, and that's why we have agreements with specialists in Mexico to look after the patients. Patients at the end of the day are the most important assets to us, and it's a privilege to be a part of this team.
Yes, I've been practiced the implant for 10 years, and I really study hard and try to apply the new techniques in my practice. But I always have a hard time to improve my skill and catch up the new trend or the new techniques. But GDIA is very open group, and then they help me a lot to get the new techniques and the new skills. So I learned a lot about new techniques and new materials, And then, I apply it to my practice, and now I make it my practice more easy and simple and less headache.
To me is more than an implant system. They came to me at a very difficult time in my life, and without getting too heavy, my wife and kids were having health issues, and having that stress over me caused me to be very mundane and lackluster at work. My professional fire and enthusiasm were suffering. John Kim and Dr. Jim Kim were kind to me and gave me the opportunity to become more excited about my job again. With the upcoming symposium and the clinical sessions down in Mexico, where doctors can get one-on-one instruction on advanced surgical techniques, gets me excited, and I want to pass that excitement on to other doctors.
Well, to be honest with you, I have had the pleasure of meeting so many wonderful, educated, experienced surgeons, and with such a great network of mentors, faculty, I have really been able to expand my previous experiences with surgery. Owning multiple offices in the LA area, I've built a great foundation using surgery, and my belief is that the future of dentistry heavily involves implants, and by joining such an organization, it has enabled me to really serve my patients better, serve my community better. It's been professionally, personally, and economically a huge advantage to have such a wide array of people working with me whom I can call and learn from and teach. And so it's been a pleasure of mine to be able to return that favor to new doctors who are interested in expanding their own knowledge. Not only have we had experiences here in the United States, but internationally, helping and teaching at the same time, and it's really a great pleasure to be able to give back the way I've received from such a fine organization. I hope that we continue to be able to touch doctors and enable them to help their patients and grow their practices, and there's definitely a win-win with GDIA and also with dentists with whom I work closely. So it's been a pleasure, and I hope to continue to grow with this fine organization and see where it takes us.
I've been placing implants, it's almost over 7 years, more than 7 years, almost, yeah. I like a lot of things about dental implants. The reason I like it most, because I can help patients restore to normal function, aesthetic, and also they can function well with the implants, and they can restore the teeth normally. And with the implant system, I am able to expand the horizon to the patient, so they can have a lot of treatment done with the implant. I can to say about GDIA is a wonderful program. I like it because it's a one-on-one mentorship program, so that doctors can learn a lot about it, the basics about implant dentistry, as well as they get a hands-on training to place implants, and they can be more comfortable doing on their own when they get to their office. That's why I like GDIA a lot.
There's a lot of people or dentists placing implant, and just want to teach those that are interested in placing implant to do it correctly and safely. Need to know generalized area of placement and what to avoid, and to kind of see what's the limitations, and maybe if it's beyond the limitations, you might want to send a specialist.
First, I went to the medical school to become a surgeon, and then economic situation have changed, and I had to go to the dental school. So I attended dental school, and I graduated 17 years ago. And after practicing a couple of years, I have felt like general dentistry, it's not so much, there's so much you can do. So I decided to expand my knowledge, and I went to the implant dentistry. So about 12 years ago, I started implant dentistry, and I have tried many different many implant technique. I have tried different approaches and different implant systems and sizes. And about 3 years ago, I have found a dentist, and I used it over 3 years. And to expand the dentistry in implant dentistry, actually, you need the implant that is very reliable, very easy to use, and very economical. And that's basically what dentists provided for me. Well, being a mentor is basically giving me opportunity to share my experience, and I have done over 1,000 implants in dentist implants specifically, and over probably 3,000-4,000 of other brands. And I have a lot of videos and a lot of pictures before and after, a lot of knowledge that I would like to share with the colleague. By teaching an implant, giving you more opportunity to expand your knowledge and giving other colleagues opportunity to do the better dentistry than they can.
My background in implant dentistry, I started implant dentistry the first time on about 87 with Dr. Robert James at Loma Linda Implant Study Club. And then I stopped for a while because at that time the implant system was not so advanced, and there was a lot of lawsuits, and it was the blade implant. Then I returned back again on 1995 and start my implant. I took several courses. Implant dentistry is changing every single day, and when you follow, and believe it or not, after I started my first implant after that was open sinus lift, which many people say, oh, you are crazy to start with something open sinus lift, but it's so simple and it's not complicated, and if you know the right way and you have the right guidance, you won't lose it, and it's a big challenge for me as a mentor, and I love the hands-on to take somebody from simple extraction till he do implant and know how to do the difference between posterior implant and anterior implant. There is no need to talk on the beginning about bone grafting or sinus lift or something, but to take somebody who's afraid to pull a tooth from a simple extraction to surgical extraction, and how he put the implant exactly, what does he want, how to choose the case, and the choosing the case and the preliminary diagnosis is very, very important. How to plan the case is most important, not the surgical part. The planning the case is so important and so critical.